on challenging behaviour in autism from a behavioural perspective. So for people who weren't here last Monday evening, my name is Kate French. I'm a clinical psychologist full-time in private practice and a practice called Side by Side Psychology. So my focus is working on the mental health and wellbeing for clients and families, and I have a special interest in supporting families who are affected by the autism spectrum in some way. So whether that's parents who've got kids or whether it's adults, that kind of thing. I have 3 children and I don't have anybody with autism in my family, although in extended family I have nephews and family with disability and things like that. But I've been working for about 16 years with kids and teens and families all across the disability and mental health field. I feel that I am somebody who's forever learning and understanding, and that parents and carers are experts of their own kids. I wish to acknowledge traditional custodians of the land in Mildura and Sunraysia area, and want to pay my respects to the elders past and present and acknowledge the memories of their ancestors. I also just wanted to make a comment about person first language versus disability first language, just because I'm aware that some people like to use the word I'm autistic or I'm an Aspie, but other people like to talk about it as I'm a person with an autism spectrum disorder or my child has. So I'm aware there's differences in preference there, so I probably will just interchange between the two, because whenever I'm working with somebody, I go with whatever their preference is. So also wanted to make comment that although autism is diagnosed through a lens of behaviour that's a deviation from normal or typical child development, I do prefer to think about autism as a different way of thinking and perceiving and processing. So I'm going to briefly go over a definition of what challenging behaviour is, and then I'm going to have a focus today on emotion regulation and just understanding emotions with people on the autism spectrum and how this can assist in reducing challenging behaviour. And then I'm going to introduce you to emotion coaching parenting style, and then we'll have questions and answers at the last 10 to 15 minutes. Okay, so people who were here last time, we went over this, just a definition of what are challenging behaviours. So they're behaviours that interfere, there's significant concern to the family around the child that's having these behaviours. They put them at risk, they can cause harm, and they threaten the quality of life or the physical safety of the actual individual and or others. So here's a bit of a list of some possible challenging behaviours that certainly come up in my practice and with my families that I've worked with. So ranging from self-harming, that might be scratching, biting, to more serious forms of self-harm, avoiding behaviours, sexualised behaviours potentially, smearing, sensory kind of behaviours, and screaming and yelling. So understanding kids with autism and challenging behaviour, we firstly have to be mindful that they have a slightly different developmental profile. They may have differences in their ability across communication, social skills, motor skills, and maybe some daily living skills. So they can really, like any individual, can really vary very widely. The other thing is to be mindful is that we can begin to see challenging behaviour when expectations exceed their capacity to do it, or their capabilities. And a little bit about what I would say is like an autistic information processing style. So just to keep in mind that they can tend to have a high preference for predictability, for concrete information, for definite outcomes, explicit informations. They can have incredibly strong visual memories and sensitive fight, flight or freeze responses. Social reasoning differences that we are aware of, they can perhaps be triggers for challenging behaviour. They can incite shame or embarrassment if they become aware of those social differences, and differences interpreting eye contact or other social kind of norms could be interpreted as aggression or hostility. Sometimes they're narrow or intense attachment to objects and things could be perceived in a way that is not considered very socially appropriate, like as selfish and uncaring. And saying with special interests, they can be interpreted as oppositional if they're not wanting to look at something outside that. But it can also mean that that narrow focus means they might miss other social information. So just a real brief snapshot, not looking at like the definition of what is autism, but just some other things to be thinking about when we're looking at challenging behaviours and how that can kind of present. So definitely keep in mind that all behaviour is communication and it serves a purpose in that moment, and it's likely to have some sort of reward, even challenging behaviour. And an assumption that I always go forward with is children and kids and adults will be doing the best they can with the skills or understanding that they currently have. So that's why I'm always sort of thinking in that teaching mode. So last week we went into understanding the behavioural aspects. Today I wanted to really shift focus and look at the emotions and emotional expression and thinking about how intervention looks from that perspective. And this is just a quote that I love to remind myself of as what our role is with children and young people in terms of, what our job is meant to be. So when little people are overwhelmed by big emotions, it is our job to share our calm, not to join in their chaos. So that's easier said than done because it actually assumes and requires us to have regulation of our own emotions as well. So as I said, I'll be looking today at, I forgot those little ones slid in, emotion regulation and behaviour, emotional expression in autism and some myths and facts. And then I'm going to have a quick talk about empathy and the process of empathy and how perhaps that's been a bit of a confusing kind of misnomer, I suppose, that happens with autism and empathy. And then I'm going to introduce you to emotion coaching parenting style. Okay, so as I said, another view or another angle to assist with challenging behaviour is to look at the thoughts and feelings that often lead to challenging behaviour. So as somebody who was trained as a cognitive therapist, which is cognitions of thoughts, this sits really nicely with me. I would certainly say that that's much more aligned with my training than the behavioural aspect, although we look at all of it. So when we can address the emotions and support children to express them safely, we assume that that will actually help with their emotion regulation and then reduce challenging behaviours as well. So it's a common concern and request that parents wish for their kids to have better emotion regulation skills. And this can be because they come saying about how they're observing frequent meltdowns, anxiety, and other behaviours that really the parents know their kids are not having a good time emotionally. And yes, the behaviours are kind of what they're seeing, but they're really concerned that it's those strong ups and downs that they're not managing with. They may also be about wanting to actually see more emotional expression from their child. Some parents describe concerns of looking like there's a flattened emotional response or a lack of emotional response or reciprocity in terms of, sharing emotions within the family or within each other, especially around affection. That can be a common one. So these are some of the common concerns that parents and carers have. So I wanted to talk briefly about what's the actual process of emotion regulation. What does that actually mean, this term emotion regulation? So it's actually a really useful term because it can provide a way for us to understand sort of the link between emotions and then the potential behavioural problems that we might see in kids and adults. So it's defined as an automatic or intentional change of a person's emotional state that then can promote adaptive or goal-directed behaviour. So it's sort of that ability to, on purpose, change what's happening inside for the better of ourselves, for a functional purpose. So it's that ability to pause between a stimulus, which is something that happens, and our reaction to it. So rather than just sort of reacting to every kind of thing that happens around us, we have a process in between that the thought, the sort of the feelings about it. So the way we feel and interpret these emotions affects how we think, how we decide, and how we act. So we know that when we have good emotion regulation, there's a positive correlation between the way that we can cope with things like depression and anxiety. We know that it reduces the likelihood of mental health disorders developing. And I spoke really briefly last time about how in the autism community, mental health disorders are quite high. There's sort of higher prevalence with a range of mental health disorders. We know that when we are provoked as human beings, our natural reaction is the emotion processing center of our brain, which is the amygdala. It often goes into a fight or flight response. So that's typical. There is a lot of research about the amygdala in the autism community and about what role, if any, the amygdala plays, or is there differences in the amygdala, because there does seem to be extra sensitivity in terms of the fight and flight response and the higher level of anxiety disorders and things like that that we see in someone diagnosed with the autism, on the autism spectrum. So developing good emotion regulation skills allows us to buy a bit of time before we actually act on that fight or flight triggers. So yeah, building in skills around how to expand that time is really, really important. And it actually leads to a lot of the work that I actually do individually as well. So we know that when we have emotion regulation, you can be in charge of what you do and think and feel. It can help you reduce stress levels, makes you more successful, you have better relationships, and overall we know it leads to more resilience, which is something that I know parents and carers want for their children. We also know that becoming more resilient, having better emotion regulation actually leads to higher emotional intelligence. And so emotional intelligence is a better predictor of positive life outcomes. So we know that yes, temperament is part of what leads to high emotional intelligence, but that just means that if we know we've got kids that have more reactive temperaments, so whether they're irritable, anxious, shy, bit inhibited, they're going to need more support in helping them develop that emotional intelligence. So we know that for emotion regulation with kids and adults on the autism spectrum, they either fail to have or to use their emotion regulation strategies, and instead there's a lot more impulsivity. So then you see the tantrums, aggression, and self-injury. Sometimes these are misinterpreted as deliberate or defiant, but really, you know, if we come down to looking at it, it's not managing those intense emotions well. And when you look at the skills that emotion regulation requires, so it means recognizing the emotions in our mind, so being able to put a label on it. It means we have to recognize our body signals and again, know what they mean. And then we also need to know what are the appropriate behaviors that we have to do in response when we have those things. So there's actually a lot of skills that are required to have good emotion regulation. So we're going to talk a bit about emotions in general with autism, and some of the misconceptions and some of the challenges that perhaps get in the way of having good emotion regulation. So our misconception is that people with autism don't have the same emotional range or don't experience feelings as intensely as neurotypicals. So neurotypicals is just a word to say someone who is not on the autism spectrum, doesn't have autism. A big myth is that autistics are unable to experience empathy for others. So that's a very important, I suppose, emotion and a construct that we talk a bit about in, just in psychology. That an autistic person does not feel emotions because they may not be displayed on their face or in their body language in the same pattern as typical neurotypicals do. Again, this is a misconception and a myth. There is not evidence for this, but mistakes have arisen due to questions about maybe how empathy is understood and expressed, and as well about how we know sometimes emotions are expressed differently in individuals on the autism spectrum. So I'm going to go into very briefly touching on some of the work by Simon Baron-Cohen, who looked at theory of mind, which is a theory that where they talked about that individuals had mind blindness, which was that the ability to imagine another person's emotions or thoughts, he just said or felt that was typically delayed in children with autism. Although since that has been published in 1995, there's a variety of research that's come to challenge that. It's still a theory that helps us understand some things sometimes and the way perhaps people with autism process information, but it's not the whole answer. And it probably had some negative consequences in terms of, well, if they can't see or understand it or imagine it, then they're not able to feel it, which is not actually the case. So some closer facts about emotions and autism is that some people on the autism spectrum find it difficult to recognise different expressions on people's faces and immediately link them to emotion. Some people on the spectrum also have face blindness and can't recognise familiar faces, and I'll talk a bit more about this in a second. Some may not have the vocab for a wide range of emotions and have some challenges detecting and labelling these within themselves or others. And then some research has suggested that they may not be spontaneously using their theory of mind skills as frequently as other kids or other adults, but when they're not stressed, they actually have capacity in this area, but are affected by stress and attention. So rather than saying people on the autism spectrum don't have theory of mind skills, it's saying that their skills are there, but what inhibits them? Why are they there sometimes and not there other times? And so there's more research that's trying to answer that question and is doing a good job of finding out more about that. So just a really brief definition of that face blindness one. So this is called prosopagnosia. So it's a neurological disorder known as face blindness or facial agnosia. So this is where if you're impaired, and again, the impairment can vary, you may just have a bit of a difficulty recognizing someone that you're familiar with, but when they're out of context, you can't kind of recognize their face. Some are more impaired and they can't recognise faces as being different from objects, and some don't recognise their own faces. So there's a broad range of difference in terms of how much people can be affected by that. Now, this is a separate condition that can come from brain injury and just other reasons that we don't know. It can happen with people in the autism spectrum as well, and it's maybe a bit more common, but it's certainly not the same thing as. So it exists as a separate condition, and of course people on the autism spectrum may or may not know whether they have this as well. So that's just one way perhaps there's been more misconception around autism and emotions. The other condition that is a lot more common on the autism spectrum community, or in the autism spectrum community, is alexithymia. So this is the inability to identify and express or describe one's feelings. So somebody who has a high level of alexithymia, they may be aware that they've got emotional arousal going, so they may be aware of all the physical symptoms going on in their body, but they're having difficulty distinguishing which emotion and verbalizing that. So as I said, it's highly prevalent. Some research suggests up to half, 50% of individuals on the autism spectrum may also have a diagnosis of alexithymia, but it's also a separate condition. So it exists in individuals that also don't have autism as well. So we're still, it's still not fully well understood, but it's important, I suppose, distinction to make that can interfere with some of the emotional expression. So like I said, it's distinct from autism. It's not sufficient for a diagnosis of autism, and you can have both. You can have it and you can have an autism individual without that as well. So some evidence suggests that it's associated with atypical theory of mind, but not empathy. So that you might have some challenges if you're on the autism spectrum of imagining what other people are thinking and feeling, but not necessarily having a challenge of understanding that expression. If someone else is in pain, then they can really go, yeah, I've been there, like I get that as well. Whereas alexithymia is associated perhaps with atypical empathy because they can't put the name of that emotion onto it, but they may be knowing that something else is going on. So there's quite a complex relationship between those three kind of constructs. So I wanted to talk a little bit about then empathy, because it comes up again and again as something that families talk about, as saying, does my child experience empathy? I'm just not quite sure what's going on there. So as this definition says, it's that ability to understand and share the feelings of another. So there's rapport, sympathy with, understanding of, sensitivity towards, identification with, that kind of thing. So it's a very human emotion that it's sort of like we're all connected in some way. So looking at how do we know, how do we know whether someone is experiencing empathy or that whether they can do that? And this one piece of research that I was looking at just showed us how the steps, I suppose, of what an individual needs to do to actually be successful at showing empathy. So first up, an individual has to notice that somebody else is feeling something. So this requires attention going towards another person, you know, and towards the symptoms, I suppose, that suggests, you know, another emotion. So we know some autistic people, some young kids, some with disabilities may be less likely to detect those cues because they may be less likely to be orientated, which means turning and looking and paying attention to the face and things like that. And again, whether this happens in adults, there's a variety of research. Some say yes, some say no. The other thing is that some autistic-led research, which talks about a narrowed focus of attention, is that there is a tendency to take in one source of information at a time, so that very narrow focus, and that if an individual is having a moment of that very narrow focus of attention, perhaps they're missing something else going on. So perhaps they're missing someone's expression of distress. So then that opportunity to be attuned with empathy is missed because that first step in the attention is missed, not because they're not experiencing it. So step two in the process of showing empathy, once you might have noticed somebody else's emotional behaviour, you have to correctly interpret it. So is the person crying with happiness or sadness? Is it signalling joy, or is, you know, are they laughing, you know, truthfully, or is it a sarcastic laugh? So again, we've got lots of nuances amongst cultures, amongst all kinds of different areas where we have to learn all those rules about, you know, what that means, what those expressions actually mean in that setting and for that individual. So this could be a challenge because, you know, sometimes people with autism do have to learn some of this behaviour, and again, they've got to pay attention to it and they have to know the rules around it. So for step three, once they have noticed it and maybe they have correctly interpreted the emotional signals of another person, is to feel those feelings. That's sort of like the resonating, that core part of what I think is empathy really is. And when we talk about it in day-to-day terms, I think most people understand that's what empathy is, that you actually really can recognize that feeling because you've had it and you can kind of feel it at the same time. This is also the most difficult aspect of empathy to measure, but potentially the most important and a very unique component to empathy, meaning it's not, we don't do this in any other kind of emotion or thinking process. It's also the step that I believe, and many argue, is not different from individuals without autism to individuals with autism, that feeling, what you're feeling resonating is actually there and it's real and people can do that. But the other steps before it and the one step afterwards, there could be some challenges. So the final step is where an autistic person might be incorrectly judged as lacking empathy, is then that deciding and using a response. So a response to other people's signals, again, we rest on social norms, expectations, which the neurotypicals develop most of them because they're in the majority. And this is another place where, you know, maybe they don't follow the rules that the norm has decided is how you express empathy. So, and if they don't follow those rules, then it can look like you're not actually experiencing empathy in that moment, but it's just that they may not know how to kind of do that. Okay, so there's this lovely quote here. So this was from an autistic person who's an adult. So it says, there are many theories about autism, including the notion that autistics lack empathy. When you have sensory dysfunction, you are overly tuned to the environment, which includes all the emotions of the people you are interacting with, even the unspoken emotions on their part. The result can be an emotional roller coaster ride for me as I try to deal with all this bombardment of information in addition to their words. Neurotypical people may assume that we autistics are incapable of empathy when in fact we just happen to express it differently. Reactions by way of our facial expressions and body language may not match what society is used to and expects. Which I love that quote. I think that's really cool. And I suppose in terms of, you know, my role as working with kids, teens and adults, I hear a lot of comments and a lot of talk from adults who are later diagnosed, perhaps didn't know they were on the autism spectrum in early childhood, resonating and saying very similar things, that they've often been misunderstood and misinterpreted about how they respond, but they're actually over empathic and can get quite overwhelmed with the emotions of people, and then can shut down and can look like they're non-caring and so non-empathic, and that kind of that misconception or those myths going to get reinforced, that because they're not following the norms, that they're not actually having that experience of empathy, which I don't believe is actually the case. So what can parents do in terms of developing empathy and emotion regulation in their children? Well, like I said at the beginning, I do believe parents and carers are their biggest influence on kids' development. They can help by modelling their own good regulation skills. And if you're aware that you don't think you have good emotion regulation skills, that is again a reason to do work on ourselves and to get support to develop them, because we're our kids' teachers, so they do take notice of what we're doing. And then I suppose the next step is be mindful, particularly if you have a child on the autism spectrum, that they're going to need extra help in this because of some of the challenges with perhaps, you know, giving attention and those sorts of things. They're going to need lots of practice and lots of reinforcement. So then the next stage is knowing about some of these challenges that they may have in labeling and verbalizing or expressing those emotions, but that they don't have any issue with actually feeling or having emotions. So being really mindful of that it's all there. It can look like it's not, or that it's not coming out the way we would expect typical kids to be doing it, but absolutely assume that all those emotions are there and they just need extra support in how they can connect those parts all together so they can develop that emotion regulation. So the next part I wanted to talk about is a parenting style that, like I said, has a focus on a child's emotions. So not children's behaviour necessarily to manage their challenging behaviour, but focusing on their emotion and emotional expression. So a style of parenting that does that is called emotion coaching. And it has been transformed into sort of like a parenting program, and they are called Tuning Into Kids and Tuning Into Teens. So when parents become emotion coaches, the research suggests they tend to learn to trust their own feelings, they can regulate their emotions, they can solve problems, develop better self-esteem, learn well, and get along with others. Now, I should say that this is not an autism-specific parenting program. So in terms of the numbers of kids that were put into the research and that kind of thing, I'm not sure whether they identified any of those sorts of differences or not. But certainly kids with different challenging behaviour were part of the research in terms of when they've rolled these programs out. So they have done a fair bit of research on the effectiveness of them, but specifically for ASD kids, I'm not sure. The emotion coaching philosophy is that parents accept that all emotions are valid. There is no preference for positive over negative emotions or anything like that. That your children's emotions are viewed and they're kind of welcomed as a time to do teaching around them. So they teach parents to be able to communicate that to the children, that, yeah, these emotions are okay. And they help parents teach kids how to find words to describe their emotions. And then, if need, help them problem solve whatever challenge they've got going on. So you can see, the support that kids and young people that have with maybe having some challenges finding words, especially if they have alexithymia, is a kind of a core step in becoming an emotion coaching parent, is recognizing that kids are going to need support with that. So some of the different parenting styles. So becoming an emotion coach, they talk about it as a style. Some people might have that as a natural style, but lots of us don't. So the researchers that came before they turned to the program into tuning into kids have found in the research there's sort of 4 general styles of parenting. So dismissive, disapproving, laissez-faire, and then emotion coaching. These come from the book Raising an Emotionally Intelligent Child, The Heart of Parenting by John Gottman and colleagues. He has a quiz in this little book, and I can I'll show you a copy of it, but I think it's actually at home. But I can show you the cover of it. It's a great book if you want to understand about emotion coaching and the background to it before even thinking about the emotion coaching program. So, but you might know yourself, what style of parent you are, and we'd all like to be an emotion coach, but it can really depend on what our own upbringing has been and how we are under stress and all kinds of things. So emotion coaching, though, focuses on having a strong emotional connection between parents and kids, and it gives a fairly structured way, or some steps at least, to help us know how to respond in an accepting and supportive way, which in turn helps them to manage their own emotions. So the program is very well researched, and like I said, it has been designed and developed with thinking about kids that had a clinical level of emotional and behavioural difficulties. So these were kids with what we would describe as challenging behaviour that were put into the research, and it's been quite effective. So the first part of emotion coaching is to tune into emotions. So they want you to take notice of how they're looking, making some guesses about how they're feeling. And again, we then have to use our own empathy skills to think, how might we be feeling if we were in a comparable adult situation? So that helps us do our theory of mind work and jump into the shoes of our kids, and because remembering kids aren't going to have as good as theory of mind skills anyway, but of course if you've got an autistic kid, you have to be thinking about how good are those skills in them at this age or this stage. And so then it encourages you to ask a question or clarify to see if they can share with you how they're feeling. So you might say something like, "Oh, you look pretty worried," or "I noticed you look a little bit scared. Do you know how you're feeling?" Or "How are you feeling when the dog jumped up on you, or when the door slammed," or whatever it might be. So it's encouraging conversations around emotions and around what you're noticing perhaps on their face or their body, and helping it being linked back into a label for that experience. So that reflecting on the emotion, and we can make guesses about how we think they're feeling. And if that's not the case, they can say so, you know, being really open to that. But yeah, so starting with some sentences like, it looks like you're anxious about, or I can see you're nervous, that kind of thing. So kids definitely need that structure and that prompt sometimes to get them to be thinking about what emotional state they might be in. And so, yeah, tuning into that starts that kind of connection. It can be helpful to ask where your child feels the emotion in their body, because one of the aspects that I do a lot of teaching with is understanding that emotions exist in the head and the mind and the body. So there's sort of different aspects to it. Emotions have a label in the mind, but we feel them in the body and then we act on them as well. You can share some of your own empathy. So that's that modeling again, saying that you felt maybe something similar in a similar situation, or maybe you could talk about how you've had a similar experience. But we don't want this to become a discussion about our emotions. So we use that modeling to open them up, not just to talk about our own stuff. Yeah, we have to be careful of that. And then the next step about emotion coaching is helping them problem solve, which may or may not need to happen. Often the idea around getting kids to be talking about emotions or to begin to do some labeling of their emotions is that it tends to dissolve the intensity when we can get practiced at doing that. The other time emotion coaching is really important to begin with is that we actually emotion coach small emotions if we can. So we don't go in when emotions are all the way heightened. Emotion coaching works best if you go in when you see low levels of distress or low levels of anxiety, because they're going to be more able to have some discussions around it, and they're not going to dysregulate, or they're not going to become overwhelmed as easily. So that is quite a different approach from, I suppose, when we think about challenging behaviour, we talk about, you know, identifying the behaviour and going in and doing a functional analysis and really focusing all our attention there. Emotion coaching and doing this way looking at when things are milder, so finding opportunities when it's not as big, and that's not always easy to do, especially if there's some really significant behaviours going on. So again, motion coaching is not going to be needed and not going to be used all of the time. It's said that you can do lots of behavioural approaches with kids and all different other styles of parenting. Even 30% of the time, if you use a motion coaching style, can be really beneficial. So emotion regulation support, as we said, kids will need help learning words to label emotions they see in others and recognise in themselves, you know, by paying attention to what they're feeling and what behaviours they may be doing. They'll need encouragement, you know, with these first steps. And because temperament definitely plays a role in this, ASD kids may head into that hyper arousal easily. So they need lots of practice and support in this area. Okay, what I'm going to do now, I realise I just talked flat out, but I'm going to keep going and I'm going to show you a bit of the tuning into kids video, which explains it a little bit more. Let's see if we can get this working. Oops, no. Let's see if I can make it play. Here we go.
Connecting with children when they're emotional is an important part of caring for them. But raising children can be challenging at times, especially when emotions are strong. In this short video, we will show you some different ways you can help children and young people when they experience emotions. At the University of Melbourne, we've developed this video to teach you how to emotion coach your children. Tuning Into Kids is a parenting program that has drawn on the work of John Gottman and his colleagues from the University of Washington in Seattle, who found that parents and carers take either an emotion dismissing or an emotion coaching approach to responding to children's emotions. Consistently, research has shown that emotion dismissing and emotion coaching parenting styles relate to very different outcomes for children. When parents are emotionally dismissive, their children have greater difficulty in managing and understanding their own emotions. On the other hand, children who have emotion coaching parents were more likely to have good skills to help them understand and manage their emotions. These skills mean children are better able to deal with stress and conflict, have more satisfying friendships, and are better able to concentrate and do their schoolwork. What's more, they have better physical health and are less likely to have problems with their behaviour. When emotion dismissing, a parent or carer may ignore the child's feelings, distract the child from their emotions, try to focus on the positive, or be critical of the child. Some emotionally dismissive parents are warm and caring, but still don't focus on the child's feelings. Other emotionally dismissive parents are critical and harsh with their children when they're emotional. Neither approach helps the child to learn about their feelings. When emotion coaching, a parent or carer pays attention to their child's emotions, sees emotional moments as a time to connect with their child and teach them, helps their child to identify and express their feelings, shows empathy and understanding, and may help the child to problem solve or set limits. No one is an emotion coach with their children all the time. Parents need to find the right moment to talk to their child about their emotions. Following are 9 different scenarios where children or adolescents are experiencing emotions. For each scenario, you will see 2 different versions of the same situation. One where we see the parent take a dismissive approach, and then the same situation but where the parent takes an emotion coaching approach.
Stop that. You nearly hit your baby sister.
She's just a silly baby.
You're the one that's being a baby. Stop it.
I'm not baby, I'm a big boy.
Shh. Those cars are making a lot of noise. They sound very angry. Are they having a bad day?
Yeah.
Are you having a bad day too, sweetheart?
Yeah.
Oh, you sound a little bit lonely without me playing with you.
Yeah. I want you to play with me.
Oh, sweetie, I know. Babies make it hard, don't they? Because they just wee and poop, don't they?
Yeah. Silly baby.
Oh, once the baby's gone to sleep, then we can play together. Yeah?
Mum, can you read me a book, please?
You know what, sweetie? Why don't you grab the book and we can bring it up here and pop it on the couch next to Mum. Then you can turn the pages and I'll read the book. Okay?
And feed the baby at the same time.
That's exactly right. So can you turn those pages for me?
Yep.
It's called Daisy Head.